Hello and welcome. This is Dr. GERARD CUOMO. I'm here with Harlan's case, and this particular case is a single tooth implant restoration. We're now looking at restoring tooth number 8 as a single tooth implant. The dental surgeon, Dr. John Lindsay, actually placed a Nobel tapered implant, Select, and it is not a platform switch type of implant. It's just a straight implant and color code blue, so it's fairly large. So we're at a very good diameter, a very nice setup for this patient. I want to walk you through our abutment. And this is a zirconia abutment produced by the Nobel Biocare company. It was made initially with, I believe, a wax pattern. I don't have the wax pattern here to show you, but it was then scanned using the Nobel system, and then that scan and that computer information went to the Nobel facility, in which they then downloaded that information and then had their milling machine make this zirconia single tooth abutment. Now the reason why we went with a lighter shade here is so that we can take full benefit of masking any of the dark metal that you would receive with just strictly titanium. So we're going to go just one step better on the aesthetic side. So here we go. Here's our model, and we'll slide this gently into place, and there it goes. Now, much of what I like to do today, if I can do screw retained, I would rather go in that direction, but this implant was placed a little more within the arch instead of palatally, so our choice now is cement retained. But again, where do you place your margins? I instructed my lab to go just a little bit below the tissue level, not too far to sink the margin, because with cement margins we have to be very careful not to trap any under the abutment itself. So the abutment is seated, looks fairly nice, well designed. Our laboratories for aesthetics is Toby Nielsen Dental Studio in Deerfield Beach, and what Toby will do on single tooth anteriors, he'll almost always make 2 crowns and have me go ahead and try both in, and these are Empress crowns selected. Our shade is close to an A3, A3 and a half, and very, very nice aesthetic crowns, I must say. So they both were fit checked prior to me making the video. I'm just going to show you slowly how these both seat. This is the first one, and we just push that in place, and you can see there's some resistance to my finger pressure, and we hope that the tissue also is pushed a little bit so that maybe we can coax some of that tissue up into the papillar or the embrasure space here, and see if we can get some papillae to form in those areas, mesially and distally. There's the lingual, there's the facial aspect, and again, you want to try to stimulate some form of growth of the gingiva and the interprox. We did close that in with ceramic. I recontoured it. I didn't like the way the crown looked. It just looked very boxy, and I think our patient's going to appreciate the new look now. And as you can see, he also has some embrasure spaces on other teeth, and so I think this will definitely fit right in. So that's it. This is a single tooth anterior. It's going to go in tomorrow. I hope to film the seating of this so that you can see how we cement it using our earlier techniques that we showed on YouTube. We now have a new website. It's under www.gcuomo, that's GCUOMODDS.com. Feel free to see our aesthetic cases that are in our Smile Gallery, and also you'll get to channel into the videos that we have as well. Toby Nielsen's studio is under www.nielsendentalstudio.com, and you can go to that. That's spelled Nilsson. First name is Toby, Tobi. Alright, so now you have a couple of places to go and check out what we're doing, and feel free to comment anytime. This is Dr. GERARD Cuomo, ready to cement a single tooth implant case tomorrow, and we'll be in touch on the next video with Harlan's case. Take care.